Welcome to SLG Hello Doctor, where we bring you healthy nuggets of information for a great life. We all know that breast milk is the best milk. It is the healthiest love that a mother can give her baby. A perfect mix of vitamins, protein, and fat. It is the most nutritious food on the face of this earth. In this episode, our expert will tell us why the decision to breastfeed her baby is the best decision that a mother can make. Viewers, we have with us today Dr. Jyothsna Prayaga, Senior Consultant Pediatrician at SLG Hospitals, Hyderabad. Welcome, Dr. Jyothsna.
Thank you.
We are very glad to have you here at SLG Hello Doctor.
I'm pleased to hear.
Doctor, we've just crossed World Breastfeeding Week, which is from August 1st to 7th of every year. And now that you're here, let's talk about breastfeeding and what are its benefits. Can you start by telling us how long should one decide to breastfeed their baby?
The baby should be started breastfeeding as early as possible, and exclusive breastfeeding has to be continued till 6 months of age, and it has to be continued along with the complementary feeding till 2 years of age.
Doctor, breast milk is supposed to be the best and first vaccine that a baby can get. So when should a mother start feeding her baby from her breast, and when should she stop?
As we all know that breast milk is a universal medicine, and having breast milk is a birthright of the baby. So the breastfeeding can be started immediately within 15 minutes to half an hour for a normal vaginal delivery, and within an hour for a cesarean section. So exclusive breastfeeding is giving only breast milk to the baby, not even any prelacteal feeds like honey or water. It has to be continued till 6 months of age, only exclusive breastfeeding. And after that, the breastfeeding has to be continued till 2 years of age along with the complementary feeding.
Doctor, what are the advantages of breastfeeding the baby right from the beginning?
We have lot of advantages of breastfeeding, not only to the baby but also to the mother. So for mother, the breastfeeding will help her to regain her normal weight. It helps in easy reduction of involution of uterus, and also it helps in decreasing the postpartum bleeding, and over a long term it helps her in the prevention of breast cancer, ovarian cancer, endometrial cancer, osteoporosis, cardiac diseases, and rheumatoid arthritis. So for a baby also, the breastfeeding is very much important. It helps in the brain development and a good bonding, and it helps in the reduction of ADHD and autism, what we are commonly seeing nowadays. So breastfeeding also helps in the prevention of recurrent pneumonias, diarrheas, because it has got lot of immune protective components, and also it helps in the prevention of allergies, asthmas. The breast milk also supports the baby for the optimal growth of the jaw and also the dental configuration. It helps in the good vision, as well as it prevents the sudden infant death syndromes. It has got lot of immune protective minerals, and the colostrum, which is the first milk secreted, it is very much rich in the antibodies, and which helps the baby to boost the immunity. The babies who are breastfed, they have very less chances of obesity and diabetes in their later life, and it helps in the overall growth of the baby.
Doctor, I'm sure many new mothers come to you with painful nipples or sore nipples and related problems like that. So is that an indication of not breastfeeding correctly, not following the correct techniques? Can you throw a little light on that?
It's actually the sore nipples and cracked nipples, these are all because of the improper techniques of the breastfeeding. So the main thing is the latching of the baby to the breast should be proper, and the mother and baby should be in a very comfortable position. So this all can be prevented by taking lactational counseling antenatally along the mother as well as, and she should be motivated to breastfeed the baby, and she should be free from anxiety. So when she is free from anxiety, the happy hormones those are released, the oxytocin that is released will help in the improved production of the milk, and the frequent suckling of the baby to the breast also decreases these problems. And sore nipple and cracked nipples, they are not a contraindication to breastfeeding. The mother can continue the breastfeeding. Sometimes the mother may face problem of breast engorgement, because of which she cannot feed the baby. At that time she has to express the extra milk, and then she has to continue to breastfeed the baby.
Doctor, in your last answer, you spoke about contraindications. So, are there any instances in which the mother should not feed the baby her milk?
Yeah, there are really very few contraindications to breastfeeding. As we all know that certain mothers who are on anti-cancer drugs, or those who are undergoing radiotherapy, those who are having radiation exposure, and those who are on antipsychotic drugs like lithium, they should not breastfeed the baby. And also those babies who are having galactosemia and phenylketonuria, they should not be breastfed.
Can you give us some painless and successful breastfeeding tips?
The use of nipple shields and pacifiers, they may confuse the baby. So the baby may have nipple confusion, and it will reduce the successful lactation. And also the use of breast pumps, it also reduces the lactation. So the manual expression is always best for successful lactation.
Doctor, lots of mothers go through this anxiety that there is not enough milk, or they are not able to feed their babies sufficiently. So, is this true? Does it happen?
So most of the mothers, they anticipate that my milk is not sufficient, but this is not actually true. If the baby is passing 6 to 8 times of urine in a day and 3 to 4 times of motion in a day, and the baby is having adequate sleep after breastfeeding for 2 hours, then and there is a proper weight gain of the baby accordingly, then the milk is sufficient. It need not be always the baby cries for the breast milk. It may be for sometimes requirement of emotional bonding, or sometimes the wet diapers or wet nappies, they may cry. It's only the anxiety of the mother that her milk is not sufficient.
It's time for a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్. ప్రముఖ సామాజికవేత్త, సంఘ సంస్కర్త శ్రీ దండు శివరామరాజు, చైర్మన్ అండ్ మేనేజింగ్ డైరెక్టర్, మరియు శ్రీ డివిఎస్ సోమరాజు, ఎగ్జిక్యూటివ్ డైరెక్టర్ గారిచే స్థాపించబడిన SLG హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో, గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో, అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. Today we are in conversation with Dr. Jyothsna Prayaga, Senior Consultant Pediatrician at SLG Hospitals, Hyderabad. Doctor, in continuation then, can a mother who has been diagnosed with COVID-19 lactate her baby?
Those mothers who are diagnosed with COVID-19 positive, they can still breastfeed their baby unless the mother is very sick and admitted in ICU. A normal mother with little symptoms, they can continue to breastfeed, but they should follow the COVID precautions of wearing a mask and hand sanitization.
In which case, doctor, can a lactating mother take the COVID-19 vaccine?
Lactating mothers, they can take the COVID-19 vaccine because the mothers taking the vaccine, the antibodies can even transfer to the baby and it will also protect the baby, not only the mother. All the lactating mothers, they can take COVID-19 vaccine.
Doctor, in this day and age, the number of working women has gone up tremendously. So what happens when a new mother wants to breastfeed a baby but she's not around? How should she handle this problem?
This is a common problem faced by many working women. What I suggest is the working place should be near to the home and they should have some flexible timings to feed the baby. And the mother, she can keep the express breast milk in the refrigerator and store for 1 day. And she can store at room temperature for about 8 hours and this milk can be given to the baby.
Doctor, motherhood is such a new experience. It's a life-changing experience actually for the mother. So how can a family support her, especially since we are talking about breastfeeding, especially in this area?
It's not only the mother, the motivation of the mother is very important. At the same time, the father as well as the family members, they have to take an oath for breastfeeding their babies because the breastfeeding, it is a collective motivation. The mother has to repeatedly motivated for breastfeeding and this has to be started from the antenatal period itself as she is very new. And even the breastfeeding, she is very anxious. She doesn't know the proper techniques of breastfeeding and how to breastfeed the baby. These are all very new to her. So this gives a tremendous anxiety to the mother. So these all can be prevented by a good lactational counseling and regular checkups of the breast during antenatal visits and taking the advice of the doctors in the antenatal period itself will relieve the anxiety.
With that beautiful piece of advice from Dr. Jyothsna, we come to the end of this wonderful session. Thank you so much,
Thank you, Priya.
Doctor, for being with us
Thank
at
you.
SLG Hello
Thank you
Doctor.
so much.
Thank you, viewers, for staying with us, for watching us, for giving us your likes. We'll be back next week to talk about head and neck cancers, how to prevent, what are the treatment modalities, and so much more. Until then, stay safe, stay happy, stay healthy. Namaste. Hope you've hit the bell icon and are following all that's happening on SLG Hello Doctor. If not, do it right away.